Welcome to the Expressoul Health and Wellness podcast. In each episode, you'll learn from experts about the best practices and technologies to live a happier, healthier, and hopefully a longer life. Here is your host, Claudia Urdinola.
Hi, my name is Claudia Urdinola. I am a Colombian American. My professional training is in engineering, but my real passion is in health and wellness. I created this podcast because years ago, I encountered a life-threatening condition, and I was looking all over the internet for information. I found information that literally saved my life, and from that point on, I made a commitment to wellness. Today, I created this podcast because I want to find experts in different areas of the health and wellness. And with those experts, we can learn on better ways on how to take care of our health. We're going to learn subjects from functional medicine, hormone replacement therapies, infrared therapies for healing, weight management, stress management, sexual life. We're going to learn about exercising, nutrition, nutritional supplements, and many more. If these subjects are of your interest, please join me in my podcast. Join me in this journey to wellness. And remember, health is wealth for the body, mind, and soul. Join me. Bruce, welcome to Expressoul Health and Wellness podcast. How are you?
I'm very well. Thank you, Claudia. I am really proud to be your first guest on your podcast and supporting you in this very extremely valuable mission that you're on.
Thank you very much. I think it's important for our audience to tell them a little more about why I felt compelled to, initiate this podcast and share with them all of the information that we're going to be sharing in our episodes. But today, I would like for you to tell us a little bit about yourself.
We're both on this mission. I am very happy and pleased to be your first guest. I really feel special in many ways. One, because you're my beautiful wife. And two, I'm the first guest on your mission to really send messages out to the people in our country and, in fact, all over the world about the benefits of living a healthy life. And that takes on many modalities, from physical fitness to dietary concerns, and also something that's often overlooked is the taking care of your spirit and your soul. So I'm happy to join you in this. A little bit about me. I'm 74 years old and feel very fortunate to have such a beautiful wife who's on this adventure with me, and just taking it to new levels, not just with us. I mean, you're a professional in the area of engineering. I'm in the area of information systems for the healthcare industry. I've probably been in over half the hospitals and physicians' clinics in the United States. So learned a lot about healthcare, although I'm not a healthcare provider. Certainly in that discipline, when you supply technology to physicians and hospitals, you learn a lot about the protocols. I actually did work in 2 hospitals. One is a director of budget and cost, doing all the physical operations for the hospital. Another large hospital corporation, I was the chief information officer, so I was in charge of putting all the information technology platforms in place. So did that. Prior to that, going back into ancient history, I was in the military back in the late 60s, early 70s. Being 74 years old, I was of a vintage where people of my age were being drafted into the military. I was in school, but my number was coming up. And I had this concern that I was going to be drafted and put in the Marines and sent on the front lines in the battle zones of Vietnam. So I said, well, I'll take another route. I'll join the Air Force. I don't think they're in as much combat as the Marines or the Army or the Delta Force, different organizations like that. So joined the Air Force, had a great duty station in Colorado Springs with headquarters NORAD, which is a North American Air Defense Command, which I went underground every day under 3,000 feet of solid granite in Cheyenne Mountain Complex. And we really monitored incoming. If there was a missile fired from some adversary, we tracked that. We alerted the Strategic Air Command, and that was our first line of defense against someone invading our country. So did that, and then it was great duty. Colorado Springs is beautiful. One day I got orders to ship out to Vietnam or Southeast Asia, and which was really at 19 years old. And they're going to put you on a plane and send you halfway around the world to get involved in a conflict. So my first duty station in Southeast Asia was in Nakhon Phanom, Thailand, which is on the Thai-Laotian border, right on the Mekong River. If you went in a direct line, I was 70 miles from North Vietnam. And the mission of our base was to bomb the Ho Chi Minh Trail to keep the forces from North Vietnam, which was being supported by China and Russia, sending armaments to fight the war in South Vietnam, which was our ally at that time. So did that, and after leaving the military, which a lot of people said, especially the career military people said, don't do that. You probably can't get a job on the outside, so you better re-enlist. Stay with us.
Wow.
I really didn't want to do that. I believed in myself. I hadn't finished my education. I wasn't a trust fund baby, so I used a GI Bill to go back to college and specialize in healthcare information technology. And at that time, they didn't call it information systems. They called it data processing. And then married information technology with healthcare. It was a good decision for a 21-year-old at that time to make that decision, because I felt like healthcare, people are always going to get sick, so I'll have a job. And if I married that with information technology, which was in its infancy at that point, I'm sure the kids today, our kids, don't remember 80-column card punches. They don't remember 8-inch floppy disk. They don't remember those very early on systems that were in place that Steve Jobs and Bill Gates and people of my generation, the baby boomer generation, really pioneered.
Well, that is all extraordinary experience. And I'm sure we're going to have other times where we're going to, learn more from that time, because it's extremely important, especially all of those, beginnings of the healthcare information technology and how today, we have our health records electronically and all of these apps that we can consult our test results, and all of that integration is so great. But even though we have all of that technology, the state of health hasn't been affected that much.
Yes, the industry that I've been able to make a living in and work for an extended period of time, even working at the top of my game in my industry today, really is over a $4 trillion business. Healthcare information technology and the broader spectrum of healthcare delivery, the healthcare spend in this country is over $4 trillion. It's larger than most of the economies. If it were an economy into itself, it would be something like the 5th or 6th largest economy in the world.
And yet the American people is not healthier today than it was before we had all of these technologies.
You're absolutely right. I remember, in fact, I attended John F. Kennedy's speech in Kenan Stadium in Chapel Hill, North Carolina. And one of his big programs back then was youth fitness and being in shape, the kids working out. Of course, they didn't have the distractions of different devices, cell phones and iPads and things of that nature. We really had an emphasis on health and well-being back during the Kennedy administration. But today, if you look at that healthcare spend of over $4 trillion, where do we rank in the world in terms of overall state of the health? Something like 25th, 6th, or 7th, and probably dropping. And to me, when I look at it, we need better information technology, but we really need to effectuate a better health condition. We need better states of health well-being, and that's done, in my opinion, by prevention rather than sickness. Let's focus on wellness and well-being rather than sickness.
And prevention. Exactly. And that is why we're here today. Some of my inspirations and, let's say, my main motivation on doing this podcast was because that terrible episode that I suffered in 2015, which I'm going to tell you a little bit more about that, because that was exactly the point of no return, what I said. Is the point when I really made health and wellness on my mission. I mean, I always been, into the wellness and healthy living all my life in different countries that I live and practice as an engineer. I always was focused on, eating healthier and always clean food and exercising. But in 2015, I had some fibroids in my uterus, and they got together and formed a giant mass that basically... I thought you were pregnant, baby. I know you were always commenting on me. You say, baby, all of that exercises that you do and you have a little bump, you need to do more abs. And I thought it was like normal. Yeah, I felt a little bumpy, but it wasn't, something of big concern. I did have my MRIs and, yearly checkups with my OBGYN. Back in that time, we were living outside of Nashville in our farm. So everything was kind of normal. We were eating all organic food. Everything was great. And then one day I felt a tremendous abdominal pain and I lost 65% of my blood overnight. I remember that I called my doctor. I was so worried. I never saw so much blood coming out to me. And when I just remember that I just faded, and last thing I remember, you were picking me up to take me to the hospital and they were waiting for me on the lobby. They took me in. I mean, it was very, very, very scary situation. And what happened was that those fibroids, as I say, they got together in my uterus and they grew tremendously. Let's say all of the sudden they grew so much that they ripped my uterus from inside. I mean, it was a massive amount of blood that I lost suddenly. At that moment, I felt very hopeless. I remember the doctors coming into the bedroom. I remember I opened my eyes and I saw 5 doctors, and one of the 5 was an oncologist, and all of them had that kind of, face of concern. When I saw all of those there, I said, oh my gosh, this is not good. This is not good news for me.
No, in fact, I underestimated the degree of severity of your health condition at that time. But she had profuse bleeding, and her doctor said, pack your suitcase, come to the hospital right away. That was her OBGYN. And then when I was in the room and her OBGYN came in with the oncologist, and he announced that I'm an oncologist. That means there's a possibility that you have cancer.
It was so scary for me.
It was scary for both of us.
It was, especially because at that moment I was feeling like I had all of my health protocols in check, exercising. We were growing our own food at the farm. Everything was just nice until it wasn't. I remember that the first thing they did was basically recovering my blood. They put me in transfusions.
I think you
for
took
days.
4 or 5 units of blood.
It was a lot. I just remember that the first 3 days, my body wasn't getting accepting the blood, and they were concerned and putting more and more. Finally, my body started accepting that new blood. And, 5 days after, I was discharged from St. Thomas Hospital in Nashville. But then, the oncologist doctor that took my case, because that was that severe, he told me, you have to be at my office the day after tomorrow. So 2 days after they discharge me, I need to discuss with you how we're going to proceed. I remember that I asked him, so what do you think is going to happen? He said, you kind of need surgery. We need to, practice an hysterectomy. We need to, the mass is too big, so we probably gonna have to do a vertical incision, and you gonna be, he depicted the whole situation in a really scary way. But when we went there to his office, what I saw was kind of interesting because he got like a whole presentation.
Yeah, he had prepared it. He had a big flat screen. He had her MRI images up there, and he was convinced what he was going to do, and that was the only protocol and procedure that he could use for her condition. And Claudia had been on the internet, quite frankly, and she had been researching her condition. She'd been on the chat with other women throughout the country, and she'd even contacted Harvard and talked about a new procedure that they had that had good results in clinical trials. And so she kind of did her homework on that. And it was a snowy day in in Nashville, and gave her time to really do that research before she had to go in and see her doctor.
So the interesting thing about it was that I asked this doctor several times during the time that I was in a hospital, so helpless there, in a different time on his office. Every time I see him, I was asking him, please, I want to see different protocols, different solutions. Give me options. And he was like, no. The only option is surgery. And this is my number one recommendation. There's nothing out there to help you with this condition other than the surgery. Something inside of me, and this is like my inner wisdom, God talking through me, didn't sit well on that surgery. I just couldn't believe that the solution that he was offering me was the same solution that would be offering to a woman 30 years ago. Nothing different. So I was asking him, are you telling me that today with our technology, all of these, new ways of doing helper procedures, this is the only thing you offer me, a surgery? Yes, this is my recommendation. It's the only one, whatever. When I went to that meeting, when he had this presentation on the flat screen and all of that, I already had my research done. And remember, I was so weak out of the hospital after days of transfusions, snowing like crazy because it was early in February and we were in our farm in Nashville. And I was in that computer trying to find information, reaching out to, in different chats with people online. Finally, I found a procedure that was in clinical trials in Harvard. And I called the person that was in the name of the article, and I found it. I talked to her and she was like, yes, but we already concluded the trials and they were very successful. Where are you located? I'll say, well, I'm in Nashville. Say, well, good news, because we conducted these clinical trials with people from Vanderbilt. Let me give you the name. And she gave me the name of the doctor who conducted that trial and phone number. I called the person, and I was very, very lucky because it was so snowing and they couldn't leave their offices, and I got through him at the first call.
She actually called the head of Vanderbilt Medical School, and he was in charge of all the medical operations as the CEO or chief medical officer. And he was recently new, I think, from Iowa or someplace. And anyway, so she had a good dialogue going on.
It was incredible.
Any other situation? It doesn't snow that much in Nashville, but that day it was snowing.
It was.
So it was kind of serendipitous.
Yeah, he couldn't leave his office.
Usually it would have been 3 levels of screeners to get to someone at that level. She got through to him on the first call, had a good conversation, and he gave her a referral to a physician who was specializing in that. And what was the physician?
Well, Dr. Stokes. And she was conducting the clinical trial with him. So he was like the physician that was trained the most on performing this special treatment. And when I went there, she just looked at all my MRIs and everything, and she just brought the help that I was looking for. Just making the story a little bit shorter, what they ended doing on me, instead of a hysterectomy that was extremely invasive, a surgery that will take me down for weeks, if not months, more than anything, it will take my uterus out, and I didn't want it. I mean, why? Why I have to lose it if I can preserve it? If it's not cancer, why not? So she presented this alternative that is, they're called uterine embolization. And it was minimum invasive. And the recovery time was in days. And I was so pleased. So they took me into their arms, is how I said it. The people in Vanderbilt, I'll never, ever forget the kindness and the way that they offered me a different protocol that really helped me with my situation.
Before we move on from this and get into, kind of phase 2 of the things that really prompted you to move into health and wellness, we went back to her doctor who wanted to split her open like a watermelon. That sounds a little crude, but it's really...
For a better articulation, was kind of like that.
Hysterectomy, and she's a very beautiful woman. She didn't want a scar in her body. She could probably
my bikini.
Never wear a bikini again. So
but no,
we went
it wasn't
for
that.
The second presentation, basically, and we sat there in a chair, and as he was going through his spiel, it's standing in front of the images on the MRI. She said, excuse me, doctor. And he said, yes. And she said, before you get too far into this, I've been doing research over the internet.
And he started rolling his eyes like, here is the internet again.
Here's another one. Because I know doctors are getting a lot of that, as we as healthcare consumers now have access to just a huge massive database of medical information and treatment protocols. Okay, what did you learn? He said, first of all, I contacted Harvard, and then they referred me to the head of the medical school. I forget his name. Do you remember his name?
No, not right now.
Anyway, and I got to, you spoke to him? He's new here. I haven't had a chance to meet him yet. Really? And he referred me to Dr. Stokes. She's Dr. Stokes? I did my residency under Dr. Stokes. And then all of a sudden his demeanor totally changed. It was like, oh, by the way, that is a good procedure and an alternative to what I'm doing. When before he said, there's nothing else. This is the only way.
All of this on, that was an alternative that was okay for me.
Yeah. And he said, by the way, I'll get your scans. I'll get your images and tell Dr.
Your
Stokes.
MRIs.
And MRIs and it was like, it's almost shocking.
But you know what, Bruce? What would happen if I wasn't on that computer looking for other ways? I remember we were going into that meeting with him and you were holding my hands and you were like, baby, I totally support you. What you want to do, how you want to continue with your treatment, one way or the other, if it's the surgery or if it's this doctor in Vanderbilt with this other treatment, I am with you all the way. And I felt so empowered. And I was weak. My legs were shaky. I was just out of the hospital, 2 days before. But inside of me was this belief that there were better ways on treating the condition that I had at that moment. So anyway, I went into their uterine embolization. It worked perfect for me. It was, it's not one time thing. They do it, but then your body, just going through the process of finally eliminating those, fibroids. But I did it and it was great. It works fine. I preserved my uterus and I recovered my health.
Lines so you can feel free to wear your bikinis.
But the big take away from that situation was that there I was questioning why this treatment and no others. Why you're not presenting me with different protocols? Why you don't give it choices, options that I can choose? Give me options. No, they were doing only one and one only. After that, I'll say that was my point of no return because I really had to be focused on obviously recovering my health. I lost so much blood and my hair fell off and I changed my skin. Just imagine all the collagen and all the minerals and proteins and everything that I had to recover it back.
Well, I think being an engineer by training, you almost took a systematic engineering approach to examining different ways of dealing with this condition.
Yes.
Outside of what the experts were telling you, and you question. And the most important word when we do anything in life, as far as I'm concerned, is why. Ask that question.
Why? Question everything, because this is about you. It's about your body. It's about your mind. It's about your spirit. You have to be totally confident that what you're gonna do in your body is the best for you. And examine other ways and you decide. So that's basically what prompted me to start thinking about these initiatives. And then during all of those years, I've been, looking into different protocols. We have been implementing a lot of protocols that we're gonna tell you about in our daily lives: nutrition, exercising, and even, clean ways to eat, and ways that we can implement that into, our daily protocols. But it was really, Bruce, in 2020 when we get really, really pushed into looking our ways of living better with the COVID
pandemic. That was an eye opener, as well, as we all kind of were locked in, if you will, and you look for ways of surviving against this virus that was unleashed on the world. And we were going out still with a mindset of working out, but suddenly we can't go to the gym anymore. Suddenly, what can we do? How can we empower ourselves to protect ourselves against this pandemic? I mean, that we're all around the world were concerned about and frightened about. So again, we started doing research. We started listening to experts. Claudia is, in Spanish, they say bruja. It means a witch. That she basically...
In a good way.
In a good way. She's a good witch. But anyway, she really got to studying again, another engineering approach.
Oh, no. I just take things on my hands.
We took massive amounts of vitamin D. We took massive amounts of zinc. Living in Florida, we stayed in the sunshine as much as possible.
We bought the bicycles and we started, riding the bicycles to the beach, just trying to get sunlight. And again, what we did was like looking back on what we can do to prevent and for us to have COVID, and also how we can improve our health and our immune system, not only for COVID, so for whatever is out there, viruses or so forth. So that was a point that we really
that was an awakening, and I can say in sort of a way that you wouldn't think that COVID was actually good for us, because it caused us to focus, to use our minds, the wisdom that God gave us, the research tools
to take control of our health.
Take control. Again, another engineering systematic approach to taking control of your health and wellness. In fact, anytime I go in and maybe it's a new specialist in the medical field, they say, who is your healthcare provider? I say, me. I take responsibility for my well-being. The homeostasis, that means your well-being. And also, all of this kind of fits together with prevention and longevity. We all want to live a long life, but it's not
a good quality of life. It's not
about longevity only. As long as we're here on this earth, in this dimension, we want to live a high quality of life. Like I said, I'm 74. All of these things have been very good for me. I have a much younger wife, beautiful wife. I have amazing children, and I want to be here. I want to be here as long as I can.
We want to be able to enjoy them and be healthy and vibrant. Now, something that I also want to tell you and tell our audience is that basically in that goal in mind to have perfect health is something in that I want to share with you guys on this podcast as we go on, is that the well-being is not only on the body, it's in the mind and it's in the soul. It's a holistic approach on what we do every day to bring our current state of health to optimal, to be much better out with our own bodies, the way that we perceive the world. During the COVID times, I just remember that the news were so scary, that all of this fear, a lot of people didn't know what to do. You don't know how bad it was. So I will say that as much as the physical concern of getting the virus, it was also this worry that causes people anxieties and stress, So by learning how to deal with all of those components, the body, the mind, and soul, I think we came across to practices and different protocols in our daily lives. We also met a lot of people, professionals in different disciplines into the wellness community that they were amazing. And then we said, wait a minute, we would love to share this with the world, with people like us. I'm not a doctor. I'm a professional engineer, and I will always apply that training, that set of mind to everything that I do. But more than anything, I'm a woman. I'm a normal person just trying to reach, information to learn better ways how to live better and happier. So that's what we want to do here. That's my main mission.
Going back to the amount of money that we're committing to healthcare in this country, we should have a better return on investment. The return on investment is not always building more buildings. It's not always buying more technology. There's simple things. I think some of them, of which Claudia will demonstrate in her podcast, are things that you can do from a technology standpoint that probably harken back to the times when the Native Americans were in sweat lodges and things of that nature. She, by the way, interesting enough, has lived in 12 countries. She actually used to go to retreats in Chile and Mexico and places around the world, and really focus on her spiritual being too. That was one thing that really attracted me to her. Is I had gone through a divorce, and I was looking to connect somebody that I had a spiritual connection with, and I said, in God, universe, it wouldn't be bad if she were Latino, because I really think Latino women are gorgeous and very pleasant. So, and God delivered this beautiful person to me. She's a light of my life. She lights up a room, and she is what she is. She's beautiful on the outside, inside, and in her spirit. So I think that's enough on that condition and COVID. She's got
I'm on a mission. I'm on a mission to share with you guys and find professionals that want to spread the word on wellness, different ways, different strategies, treatments, different approaches to diet, different approaches to exercise, ways that you can, implement in your daily lives to improve your health. And more than anything, encourage you to take control of your health, to question everything. So if you want to learn those things and would like to have a good time with us listening to the professionals on each episode on this Expressoul Health and Wellness podcast, tune in and join us on this journey.
And she's got quite an array of professionals already aligned and scheduled that will bring light to this subject of health and wellness. And by the way, Claudia, like I said, lived in 12 countries. Her first language is Spanish, English, and she also lived in Brazil, so she can speak Portuguese as well. So we want to open our audience up to the multicultural people with different languages, because we're all in the same family and we're all affected by these maladies and these sicknesses. And we don't like sicknesses. We like wellness.
Thank you, Bruce. Thanks for joining us on this podcast and being my first guest. I think we had a great story to tell.
And it's even going to get better as we bring in these people that we've been following, who we know are really bring about alternative treatments that are less catastrophic, that are less invasive, and again, prevention. One last note, the biggest ally of COVID was obesity, morbid obesity. 85% of the deaths that occurred were because people were obese. Anytime you're obese, then I've struggled with that. My family struggled with that.
Hey, you're gonna be 75 in August and you're looking amazing. I bet out there are people that wanna learn what you do to keep yourself in such a great shape.
You know, and I'm happy to share that because I want everybody to have a good quality of life. And I don't want people to give up on themselves at a certain age. Well, I've turned 40. I've turned 50. And then you start getting messages from the AARP. Screw that. You know, you can have a good quality, energetic life, both physically, mentally, and otherwise, and a good intimate life with your partner as well.
All of those things are coming in our podcast. We're gonna have, as I say, professionals telling you different, from different disciplines to enlighten us in all of this amazing knowledge that is in our hands, is there, is available, and we have to learn how to live better ways, you know, and treat ourselves with respect and love and be happy.
Okay, well,
thank you very much.
You're welcome. Sign us off for now until the next time when Claudia brings her guest and does deeper dives and enlightens you with information you probably have never been aware of.
Thank you very much. This has been a great pleasure. And again, I see you next time in Expressoul Health and Wellness podcast. Bye-bye.
Thank you very much for listening. And if you like the information that we shared with you today, please subscribe to the Expressoul Health and Wellness podcast and follow us in the social media outlets of your choice. Until next time, please remember, health is wealth for the body, mind, and soul.